You said a lot of interesting things there. The first one I want to touch on is, why is there an increased association with people who have MASH and gastric, colorectal, pancreatic cancer? Is that just a correlation, or is there some sort of causal or amplifying relationship that we know of?
Well, presumably there's a causal relation, but uh, to my knowledge, we do not know the reason. But it's been documented in multiple studies, and it's an accepted thing in the world of people that take care of fatty liver. So you have to be very careful in women that have this to do mammograms for breast cancer screening. You have to be very careful with men and women to do colorectal screening. These types of things that we already are supposed to be doing, they're particularly important in people that have fatty liver because of this slight increased risk.
I wonder, does fatty liver cause hormone changes or anything else along the lines of, body processes? Do they heal slower from wounds? Does it have any of those
Yeah,
effects?
I don't know that fatty liver itself causes hormone changes or healing changes. Now, of course, if you're cirrhotic and your liver is very, very damaged for any reason, including fatty liver, you can certainly have problems with wound healing and hormonal changes from the cirrhosis and the development of end-stage liver disease. I'm not sure if fatty liver specifically, outside of the development of cirrhosis, actually impacts that stuff.
Gotcha. Let's talk a little bit about hypertension. Are there any specific anti-hypertensive agents that show a benefit in reducing fatty liver, liver fibrosis or inflammation in MASH patients?
I've not heard of any specific antihypertensive agent that is better than another. The most important thing for the cardiovascular risk that these patients have is to be on some agent or some group of agents that keep the blood pressure down, because you really want to mitigate the risk factor for having a myocardial infarction or a stroke. So I don't think there's a specific agent in the hypertension world, but aggressive management of hypertension is very important.
When it comes to obesity management, when do doctors start to consider anti-obesity medication specifically for MASH patients?
That's another great question. You know, many studies in the world in people with fatty liver all around the world have demonstrated that one of the most effective therapies of fatty liver is weight loss. Weight loss. And it turns out that if patients lose 8 to 10% of their body weight, 8 to 10%, the NASH, the steatohepatitis aspect that they have that we think drives fibrosis, can actually resolve. And fibrosis, the damage to the liver that we previously thought was irreversible, can sometimes even reverse. So weight loss is a critical recommendation for patients that have fatty liver. Now, of course, weight loss is very difficult. The older you get, the harder it is to lose weight. You know, when I have patients that have morbid obesity and they are diagnosed with fatty liver and they come to see me and they're sitting there and I tell them that weight loss is a very, very good idea, they don't look at me and say, "Oh my goodness, what a great thought. How did I never think of that?" They all have, of course, been trying to lose weight most of their lives, and it's extremely difficult. It's difficult for anybody, but it's very difficult for them. So when patients have fatty liver, it is a very good idea for physicians to consider ways to help patients lose weight. And that can include medications, that can include procedures like a gastric sleeve, bariatric surgery, gastric sleeve, or gastric bypass surgery. That can include behavioral therapies for them to try to help with weight loss. So there are many avenues for patients to try to help them lose weight if the patient is invested in trying to lose weight.